Assalamu alaikum, everyone, and welcome to Faithful Healing with Hannah. Today, I'm super excited to be introducing a guest that I've been wanting to have on the podcast for a minute now. We'd like to welcome Dr. Abrar Al-Shaer. She is the owner and clinical dietitian of Nourish Women Nutrition, a women's health, functional, and integrative nutrition practice. In her practice, her and her team help women with their hormone health challenges, including PCOS, painful periods, endometriosis, infertility, prenatal and postpartum care, perimenopause and menopause, and more. Dr. Abrar received her PhD in nutrition from UNC Chapel Hill, where she completed her dietetic specialization in high-risk OBGYN. She published numerous clinical studies in the field of precision nutrition medicine. Dr. Abrar is also specialized in herbal medicine for women's health with over 10 years of experience as an herbalist. MashaAllah, tabarakallah. At Nourish Women Nutrition, Dr. Abrar and the team incorporate herbal medicine with medical nutrition therapy to give their patients the highest quality of care. I'm going to bring Abrar on, inshallah, and just allow you to give a brief introduction. Assalamu alaikum, Abrar.
Alaikum salam. Thank you so much for the very kind introduction.
No problem. Thank you so much for coming. A brief, just like to talk about the kind of serendipity nature of this episode. I started following you years before this was even a thing. Like before I had my coaching business, before I ever
Really?
did trauma coaching. Yeah. So I don't know if I'm following you on my business account or my like public profile, but on my private account, I'd been following you for years. And
Oh,
yeah, for me, it's definitely something that I think is so incredibly important because the reason I started following you was it was during the time, this might have been right before I started studying medicine or during studying medicine, but I was dealing with PMDD. And for those who don't know what PMDD is, it's premenstrual dysphoric disorder. Essentially, you get just horrendously depressed right before menses. And it felt like this constant roller coaster. And I was like, oh my God, there's got to be something out there that isn't just birth control. Like there's got to be something more than just birth control to help manage this. And so that was my first time kind of taking a dive into the world of integrative hormone health. And for people who truly don't understand how important your hormones are, they might see something like an episode like this and be like, this doesn't mean anything to me or this doesn't affect me. But I'm sure you clearly know because you've worked with women. God knows how many women at this point, if you've been practicing even just the herbal side of things for 10 years, but the number of followers you have, it impacts so many men and women, but you specialize specifically with women. So I'd love to throw the question out to you. And for anyone who's watching live in the chat, as usual, please drop a salam and let us know where you're watching live from. What are hormones and what is hormone health and why does it matter?
yeah. Thank you for asking. And it's a small world. It's so nice to hear that you were following along from a while. So I like to usually describe hormones as your messengers in your body, right? Their main job is to communicate between your different organ systems. And so, for example, right, when we have our periods every month, right, that is a reflection of our body communicating, oh, there wasn't an egg that was fertilized this month. We're not pregnant now. And
Mhm.
we need to shed this menstrual lining. We need to make sure that we release the lining that we built up in preparation for pregnancy. So, to put it simply, whether there's obviously like women's hormones or gynecologic hormones like estrogen, progesterone, those things. And I
Mhm.
think a lot of women, when they say hormones, that's what they think of.
Yep.
But collectively, hormones can mean also your thyroid hormones, your pancreatic hormones, your GI hormones. And so they're all working together in tandem to communicate and kind of have like a symphony almost, like it's like an orchestra that's playing exactly in tune. And so when one end of the symphony, I guess you could say, or one end of the orchestra is off and being too loud or too disruptive, that impacts everything else. And so I often like to say, your hormones are the reason why they're so important is because they are a crucial reflection of how that communication is going. And
Mhm.
so if part of that communication process is disrupted, if any part of your endocrine or your hormone systems are not perfectly in sync with each other. I guess another way you could think of it is gears, like different gears that are in sync. If one gear is not working, it's going to cascade into everything else. And so when a woman tells me she has fibroids, or she has fertility issues, or she has gestational diabetes in her pregnancy, that's never isolated. It's always going to impact many other systems at the same time.
Yeah, subhanallah. By the way, Abrar, I think your picture might be freezing.
Oh, really?
Yeah. So if you want to, people who are watching live in the chat, let me know if it's just on my side or if you guys can see it as well. So maybe turn off the video, then turn it on, or if you want to disconnect, then join again. Let me see.
Okay.
Yeah, you can always like disconnect it and then just rejoin, and I'll take over for a second. You're good now, I think. Yes. Okay.
I'm good now?
You're good for now, inshallah.
Okay, sounds good. Just let me know if it's an issue again.
Yeah. So, subhanallah, I like I mentioned in the beginning, I studied medicine, I practice medicine at this point. Alhamdulillah, it's been a long time coming. But what's super interesting is just in the realm of hormone health, right? The way we are trained in the Western model is very simplistic. I mean, your patient comes to you, I'm having super painful periods. Cool. Let's put you on birth control. Someone has, PCOS. Cool. Let's put you on birth control.
Yeah.
My periods are not regular.
Let's put you on birth control.
Control.
Yeah.
I'm having super heavy menstrual bleeding, right? I'm like, my iron is regularly dropping. I'm anemic, and then I supplement, and I'm not anemic anymore. Then I get my period again, and I'm anemic. Let's put you on birth control. It's like birth control has become the sole solution for any, gynecological issue. Fibroids. Okay, let's, if it gets big enough to where we care, maybe we'll cut it out or we'll just remove your uterus altogether. And it just became so accepted. I mean, there's such a huge, almost, I don't know, like it was a crusade when it came to birth control. And certainly it can't be denied that there's research on the decrease in risk of cancer, and that's oftentimes what you'll hear researchers or medical providers talking about. But I'm always skeptical, right? And I say this as someone again who's studied and practices Western medicine. Anytime we say that there's only a single solution for an issue, so I'm curious to know, first of all, what are your thoughts on kind of birth control being the top thing that we go to when it comes to these issues? Then maybe even any stories of like kind of opening people's eyes to the idea that there are alternatives that don't just mask the issue. And some maybe stories of clients you've had, or I don't know if you call them clients or patients, but clients or patients that you have had who thought this was the only solution, and then with an integrative approach, were able to really heal.
Yeah, thank you. Yeah, so I think there's multiple factors as to why birth control is always the automatic default most of the time. So one comes from the Western model of medicine. It is very, I guess, like you said, kind of very similar to that, imperialistic almost approach of like, we must conquer and control. And I feel that with birth control, oftentimes it's like, okay, well, we don't understand what's going on, so let's just like control everything. It's like almost this need to just control the woman's body and know exactly what's happening, and rather than work with it, rather than embrace that it's different, embrace that it's messy, embrace that hormones are difficult and that there's going to be fluctuations and that you have to try different things to figure out what's going on. But rather the default is like, no, let's just mask everything and just like close any potential avenues of investigation because we can control things at 100% with this pill. Which, I mean, there's still some lack of control even with birth control. But I think that the way that Western medicine kind of came out to be, and just even with big pharma and just the way that, like classically, it's almost this very Eurocentric approach to care of like, we take control and that's it. Don't don't think further beyond that. And I think there's a big history with that in women's bodies in general, right? Even the way that OBGYN like training was first established here in the United States. A lot of women of color and Black women were used in experimentation for a lot of things.
Yep.
It was very much a conquering type of approach, unfortunately, that it was established in. So I think that there's some roots to that history. But then also, I'd often say too, it's not that providers who prescribe birth control in situations where that's not the only option are ill-intentioned necessarily, but many times they just have no idea of the other options, and because they don't get training of those other options, and no one ever teaches them that there's other options. And so, for example, very few providers know that there are actually clinical studies on using ginger root for menorrhagia, basically really heavy bleeding. A story I like to share often, there's a patient who I saw many months ago, and she was having really heavy periods, and I mean, like bleeding through her clothes. She'd have to bring another change to work. It was very disruptive, and many of the women in her family got hysterectomies because of this. They got their uteruses removed. And granted, I mean, they didn't even have fibroids. Their periods were extremely heavy. And all the time, the only solutions they were offered was take birth control or get your uterus removed, right? Again,
Cut it out.
Exactly. That approach to care of like, let's just cut out the body piece that's causing the issue, right? Or let's control it, right? Instead of trying to understand it, unfortunately. And again, it's not necessarily to the fault of the providers, but a fault of the system training, I think, medical providers in this way. And what was really amazing to see is, she didn't want a hysterectomy. She wanted to potentially conceive down the line. And so, I told her, let's try ginger root and let's try omega-3s. We did a dosing regimen to both of those, and her heavy bleeding was actually completely resolved within just 1 month of initiating the 2 supplements. I mean, these are cheap, simple solutions. And do I promise that everyone will have the same exact response? Not necessarily, but there are dozens more options than just ginger root and omega-3s that really help with heavy bleeding. And hysterectomy, cutting out the organ that makes you who you are, it is not the only solution, of course. There's birth control.
Yeah, I have a lot to say about the surgical side of things. Before even going to PA school and studying medicine, I was working actually in a neurosurgery clinic, neurosurgery and spine surgery clinic, and there's this. Okay, surgeons by training, that's what they're trained to do. They're trained to cut, and they see a lot of success in what they do, and we need them. There's no dismissing that. But because of that, there's an element of like dissociativeness that they need to be in when it comes to the full like emotional impact that these things have on their patients, because otherwise it just becomes something that that hinders their ability to do their job when they need to do it. I mean, if you don't want to be so overcome with emotion when you are cutting out a brain tumor for someone, because you know how like traumatizing that might be for your patient. You have to be able to focus. And so very often I caught this when I was before PA school, then even during my clinicals, which is, yes, there's a point of education for patients. It's legally mandated. You have to let the patients know these are the risks associated with the procedure. This is, what you can expect. But the emotional care side of things and the true like breakdown of what the post-operative experience emotionally is not usually focused on. So, or it's being explained with medical jargon that the patient truly doesn't understand, and they're seeing this person who's like has an education around this, and there's a lot of trust. And then I cannot imagine what it would be like to be a woman in that situation who is being told your only option is a hysterectomy, remove it, you're just bleeding too and for those who are not in medicine, they might hear this and then be like, what the heck? This is evil. No, I don't think you guys understand what it is to have such heavy bleeding month after month and the impact it has on your health, right? That needs to be addressed. It is dangerous. It is so to be chronically anemic in that way is extremely dangerous. So don't like bag on,
Sometimes the hysterectomy is the solution for a small subset of women, but I think it definitely is overdone.
Yeah. And so like I can't imagine to be post that and then not realize, well, especially if the ovaries were also removed, and in many cases it is, the impact that it has on a woman's hormones, and then the way that impacts her energy levels, her emotional, her emotional state, and no one telling her that this was going to happen, or
Yeah.
finding out that there was another option and she was never told about that. You can't get, once something is removed, you can't transplant that back
Yeah.
inside of you.
Exactly. Yeah,
Yeah.
and a lot of my patients, they often ask me, "Well, why doesn't my OBGYN know about this? Why doesn't she know that?" For example, I like to also give the example of like period pains and omega-3s. We
Hmm.
know, we actually, the biochemical mechanism of how period pains happens, we know it, right? It's not even ambiguous. We know
Hmm.
exactly why omega-3s really help as a treatment. And I've seen it
Hmm.
hundreds of times at this point. It's appalling to me that it's not a first line treatment.
Mm.
But as I always say, remember your OBGYN trained, right? Their residency,
Residency.
it's a surgical residency. Yeah, like they are trained not only as surgeons, but that is a huge part of their training, right? And that preventative medicine, unfortunately, lens is left on the wayside for a lot of trainings that
Hmm.
a lot of
Hmm.
agencies. Yeah.
Yeah. You mentioned omega-3s. I'm sure people are going to be interested, and I'm interested too, the dosage for
Yeah.
anyone who's dealing with period pains. I'll type this in the chat for people.
Yeah, so the dosage is going to be anywhere between 1,000 to 2,000 milligrams a day. I will say if it's not resolved with that, you can go ahead and increase it to 3,000 to 4,000 milligrams a day. Typically, I start patients at 2,000 and then
Hmm.
I dose up or dose down depending on how well they're responding. I had a few patients who responded well just by getting in more omega-3s to their diet, but I will say that's not the majority of the time. We did a little bit more than just that, but sometimes that works too.
Yeah.
So most important thing though, when you're finding an omega-3 supplement is the quality. There's a lot of, as I like to say, rotten fish on the shelf with
Hmm.
omega-3 supplements. So you want to make sure you're getting something that's good quality. So you want to make sure that it's third-party tested if possible. If not, at least check the back and make sure it's made with low mercury fish like sardines or anchovies. And then also make sure that it has antioxidants because omega-3s rot very easily. So you want to have an antioxidant which prevents the rotting. So
Hmm.
that would include something like tocopherols, which is like a form of vitamin E, or rosemary antioxidant extract.
Awesome.
So, yeah.
I'll end up probably reaching out to you for like if you have an affiliate or a link or anyone you specifically recommend, or you guys create one to share, because I'm sure people are going to be like, I don't know how to read these in the back of these labels.
Yeah, yeah, of course. I'd be happy to share
Inshallah,
them.
inshallah. Because yeah, in subhanallah, it's funny you mentioned omega-3s. My experience with omega-3s was actually when I was doing looking into alternative treatments or for depression, and there's not a ton of, at least at that time there wasn't a ton of data. It was still um, being investigated, but I thought, okay, I mean, this isn't gonna hurt me, I might as well try
Right.
it, subhanallah. And so even within the realm of treating depression,
Yeah.
this is something that we often hear about, subhanallah.
Mhm.
Periods. Let's talk periods, inshallah. You are freezing a little bit, but I hope people will excuse
Oh,
it just because the content is so powerful.
I'm so
Um,
sorry.
no, no, you're fine. You're fine. Sometimes it's just the Wi-Fi signal might be weakening. But every woman is told your period's supposed to be painful. Like, get over it. Once, pop some ibuprofen, buck up, go on with your day, stop complaining. And like I there are women who pass out from the pain. You're stuck in bed. I cannot imagine. I mean, I think about personal experiences of mine being at work and being like, what in the world? And just having to down like ibuprofen because I just needed to get through the day. For the ibuprofen, guys, is Advil, Motrin, right? There is a limit to how much you can take. Please do not be the person who just throws 5 pills in your mouth without knowing the dosage. It can be very, very damaging and toxic to your kidney. And then if you use acetaminophen, which is Tylenol, paracetamol for those who are outside of the United States watching this, that can quite literally put you into liver failure if you overtake the dose. So always please read the labels on the back of what's allowed. I just say that because I just I'm amazed at how many of my patients do not know this, and I'm the first one to tell them.
Yeah.
So, should periods be as painful as we're being told that they are?
No, absolutely not. And I think this is like, I talk about this so much because it's the biggest offense, I think, to women and women's health.
Hmm.
In what world would we say to any other patient population, yeah, you can just be in pain for many days out of every month and you just put up with it and we're not going to bother doing anything about it and goodbye,
Maybe
right?
we'll put you on birth control.
Yeah, exactly. And so, no, it's not normal to have excruciating period pain. And what I often tell patients, how do you know what's normal or not, is does it impact your quality of life, right? So, meaning, does your period pain prevent you from getting out of bed, moving around, doing some things? Of course, might you need to take it a little bit easier on your period? That's normal if you feel maybe a little bit tired or there's some mild cramps. But if we're talking about a pain scale of like 1 to 10, 10 being the worst pain and 1 being the least pain, I mean, your pain really like shouldn't be beyond like a 3, right? Or, below
Girl,
around that. And so meaning like when it gets to like 5, 6, 7, 8, right? That's when we start to be like, I can't function. I know I can't work. I can't,
I
you know,
can't walk.
I
I
can't
mean,
walk. I'm vomiting. I'm passing out. Yeah, like you said. And that's not normal. It's not normal. And the easiest example I like to give as to why that happens is every single time when your body builds your menstrual lining, meaning it builds up the lining in your uterus in preparation for a pregnancy.
mhm.
When it builds it, it actually stores stuff in that lining. It's not like the lining is just blood or tissue. It actually stores omega-6 fats in there, and the omega-6 fats, this is where omega-3s come in.
Mhm.
The omega-6 fats that are stored in there are actually stored out of a wisdom. Your body needs to store omega-6 fats in there. And the reason why is because when your body knows, oh, there's no pregnancy, we need to release the lining, the omega-6 fats are the messenger that tells your lining to shed.
I
So
see.
your
Wow.
body puts them in there intentionally because in case there isn't a pregnancy, the omega-6 fats are what allow the cramping to happen. And
Mhm.
because the spasms and the cramps are happening, that's what allows for your lining to come out.
Mm.
But if we're storing too much omega-6s in there, if we're putting too much omega-6 fats into our uterine lining, that results in more intense cramps, more inflammation, more pain, more misery, more nausea, more vomiting. So
Mm.
basically, omega-6 fats are your fats that increase inflammation. And by
Mhm.
increasing inflammation, they allow for cramping to happen and they allow for the menstrual lining to come out. So that's actually why omega-3s help so much, because if omega-6 fats are this side of the coin, the front side of the coin, omega-3s are the back side of the coin, right?
Mhm.
Omega-6 fats help to cramp things, release things, increase inflammation to get things moving and going. Omega-3 fats help to cool things down, slow things. They help to lower inflammation, right? They help to ease the cramps. And so if you don't have enough omega-3s in your diet and you just are storing a bunch of omega-6s, you're going to get a much heightened cramping response. And
Mm.
this isn't like something I discovered. This was researched in dozens of studies for years. And so that's why it works so well.
Yeah, it's funny you mentioned that. I remember one his name escapes me. He is a functional medicine practitioner, meaning he was originally trained in with the Western medicine model. He went to medical school in the United States, and then he shifted to functional medicine. And for those of you guys who aren't familiar with functional medicine, it's essentially the like a root cause medicine, meaning very similar to what I would say you are a functional medicine
Mhm.
practitioner of sorts.
Mhm.
And so he got a lot of backlash when he first started sharing that he was doing functional medicine. And he said something that was so profound. And he would be like, I would have physicians coming up to me who I went to school with, who I sat in medical conferences with, saying, how could you be preaching this? There's no research on it. And he'd look at them and he'd say, you just haven't read the research.
Exactly.
The research is out there. It might not be, and it's good research and it's peer reviewed research. And it's just not maybe what you're learning in in conferences. So it exists. And Now we are in a world that I'm so thankful for, where more Western kind of medical practitioners are coming forward and saying, this is how I am, integrating research that might not have made it yet into practice models, and utilizing that to support my patients. I think about Dr. Peter Attia. I'm not sure if you're familiar with Dr. Peter Attia.
Mhm.
He calls himself a longevity medicine like practitioner essentially. He's a physician. He was actually a general surgeon before. I believe he was in residency when he decided to switch specialties, and he focuses on everything that we know that is quote unquote anti-aging. So things that just promote healthier living, longevity. So lots of non-medical or non-medication based treatment. He has very strict standard protocols. If you ever listen to a podcast with him, he is quoting research left and right. He's very, very good at what he does. But anyone else, years ago would have heard him talking and be like, "This, the research doesn't say, doesn't mention that." So I love that you just mentioned like there's tons of research on this, and nobody's just turned that into the standards of practice.
Right.
And we learn based on the standard what I'm taught and the algorithmic nature of medicine. You come in with this, we evaluate this, we make sure it's not these things, and then we go this. It is taught based on standards of practice.
Yeah.
Yeah,
Yeah, exactly.
very
And
cool.
yeah, unfortunately, I think that sometimes we have ridiculously unrealistic standards of, like, in the medical field, right? In order for something to become a standard of practice, you have to have this specific FDA approval, this specific, level of evidence, this specific, and, at the end of the day, it's all risk benefit analysis, right? So, like, tell me, what's the risk of an omega-3 supplement versus birth control pill? And we're really going to put the two on the same exact standard of proof of burden. It doesn't make much sense. Nonetheless, though, the funny thing is we approve so many medications in the United States
Mhm.
without even knowing how they work. We don't even know the mechanism. We don't even know exactly the biochemical process of what enzyme or what specific, pathway they're taking in the body. But when it comes to non-pharmaceuticals, we have a much higher burden of proof when the risk is so much lower, and it's definitely a hypocritical a little bit at times.
Yeah, I mean, there's a lot to be said about that in terms of what influences what even gets put on capitalism. We live in a
Yeah,
capitalistic
exactly.
society, and omega 3s don't make the money unless you're the supplement company, I guess. But a very different experience on a lot. And again, it's coming to light. So much appreciated with that response. We can now conclude that having painful cramping each month that leads you to not be able to function or have, function daily is not normal. There are alternatives to evaluate that are very low risk, unless you're allergic to fish, then don't do that.
Even then,
Um,
there's algae oil, krill oil, omega-3s, even if you
oh,
want to.
very cool. Okay, good to know.
Yeah.
So make sure you double check to make sure which ones you're not allergic to.
Yeah.
Subhanallah.
And I often,
Very cool.
oh, sorry.
Mhm. Go ahead. No, no, go ahead.
I was just going to say, I often remind patients too, an omega-3 deficiency is clinically dangerous. It is a problem, right? Not getting, like,
Yeah.
it is an actual deficiency, just like a vitamin D deficiency is.
Yes, yes, and don't
And,
and forgive me for not knowing the exact studies, but even I mean the familiarity of omega 3s came from its impact on brain health.
right.
I mean, like if there's any organ you want to protect, it is your brain. So
Yeah.
to even dismiss that as an option, when we know how important it is for our brain health, our brain is
Your brain,
very fatty. Our
yeah.
brain is very fatty,
Yeah,
subhanallah.
exactly. Your heart, I mean, the American Heart Association already has statements on requirements of, getting 1,000 milligrams of omega-3s or around that dose,
Hmm.
depending on the person, for your immune health, for so many things. And of course, omega-3s are not the only option. Sometimes I combine them with other remedies or other, supplements or strategies to help, especially in patients who their period pain might be related to other causes like endometriosis or something like that.
Hmm.
But yeah, it's also sad because when you just throw birth control at everything, you just mask a lot of underlying issues.
Yeah.
Someone might have endometriosis, and that's the cause of their period pain, and they have no idea. And when they go try to have a baby, they have infertility problems, and then they could have known so much sooner, taken care of things so much sooner, if only someone listened.
Yeah, I mean, the number of women who, I mean, come to, oftentimes these alternative treatments make their way into mainstream because so many patients just felt extremely dismissed, and it was like, if you're not going to listen to me, I'm going to go find the people
Yeah.
who will listen to me, and that even in itself can be a little dangerous. And I know you've emphasized in on your Instagram, and also or it might be your website. I was looking at both
We
before the
emphasize
call.
it everywhere.
Yeah, just the importance of having proper education, because there are a lot of people who call themselves nutrition experts with not a single degree or credential behind their name, or a 2-hour certification process, and there's complexity in that. You were trained as a registered dietitian, and for those of you guys who don't really know the ex the extent of understanding disease processes that you have to be able to be an RD, it's very different. Like it alarms me sometimes as someone in the medical field how many people step in and they're like, yeah, let's just do this, but it's like there's a lot more that goes on
Yeah.
in our heads, for those of us who have very particular training, than just, oh, okay, we're going to shift the diet just a bit. There's like, let's make sure and evaluate that there's not something else going on in addition to what's going on with your diet. SubhanAllah.
Yeah.
Um, you mentioned infertility. Let's talk about that. I have not looked at the stats whatsoever, so I'm not sure, but I can only imagine that there has been a surge of infertility. Like, just from the amount of women who I know in my personal life who have struggled with infertility, um, God knows our moms, like, were popping them out. And so, subhanAllah,
Yeah.
it's so different. Some might say, well, there was a lot of taboo around it, and so women might not have felt more as comfortable sharing. But just by sheer numbers, I cannot imagine that it hasn't spiked. What's going on? Like,
Yeah. No, it's definitely increased significantly in men and women.
mhm,
And unfortunately, even more and more, like in the past, like let's say our mothers or even grandmothers' generation, if someone struggled with infertility, often, the cause would be figured out more clearly.
mhm,
And it would be more rare that someone is just given the blanket diagnosis of like, just have unexplained infertility. We don't know what's going
yeah,
on. Why? That wasn't as common, definitely, as I see it now. It's ridiculous how common it's gotten. It feels like every other woman in my practice is struggling with fertility issues. And
mhm,
to be honest, just it's really heartbreaking. But like the amount of women who are so sick, so young,
mm,
is so saddening. Um, so any range from 20s to 30s to 40s, and I mean, seeing the infertility affect everyone. And actually, just yesterday, I had a patient tell me the one of the doctors that her and her partner visited. He told them, yeah, about 25% of infertility cases are just unexplained. There's just, there's no reason to it. And, I challenged that and I said, is it just that there's no reason, or rather we just don't know, right?
mm,
Or that there's actually new causes to infertility now that aren't being put into
investigated.
standards of practice, that aren't being researched properly. So just to give you one example, this is a small study out of Singapore. They were evaluating fertility in females and who have elevated blood levels of PFOS. PFOS are environmental chemicals that is basically nonstick.
Mm,
The Teflon pans that you
mhm.
use at home?
Forever chemicals.
Yep, exactly. So Teflon pans are coated with a chemical called PFOS. They have been linked to so many diseases and issues. I mean, from thyroid diseases to different cancers. I mean, the list goes on. But infertility has been recently starting to surface as one of the potential links with PFOS. And in the
Mm,
study, it found, again, this is preliminary research, so I just wanted to put that out there, but nonetheless, still very problematic. Showed that there was up to a 40% decrease in fertility for these women when they had elevated PFOS in their blood levels. So, I mean, a 40% slash in fertility and this is a singular chemical. Can you imagine the thousands of chemicals that we get exposed to on a day-to-day basis,
Oh, no, no.
from our waterway systems to what we dump in the ocean to the fragrance. Like, for example, a lot of people don't know, and this is actually I got this from the NIH website, so this is not even like the National Institutes of Health.
Health. Mm-hmm.
Yeah, they have this really nice like statement sheet on phthalates and plastics, and they were saying,
Which are found, for those who don't know, phthalates, you can find in perfumes, shampoos, hand soaps, lotions, like
everywhere.
literally. Bath and Body Works is a phthalate factory.
Yeah, exactly. And so when you see the term fragrance, that actually can mean that up to 20% of the contents of the ingredients can just be chemical fillers and phthalates. And so when you see like these bucket, ingredient terms like fragrances or, scents of some sort, you're talking, this isn't how much things that we have in our home, from our cleaners to our
Air
makeup,
freshener.
whatever. Yeah, exactly. So a lot of women have no clue that their environment is leached with these things, right? And there's little research efforts being made in it. There is some, thankfully, there's a bigger push to environmental medicine, but we are really, really behind on the amount of damage that these environmental exposures are causing.
Oh my
And
God, yeah.
these low doses make a huge difference, right? So who's to say, right? Because I know there's a lot of physicians out there and a lot of other providers that say like, oh, but it's a small amount. It's not like a lethally toxic dose.
So what? A small amount of arsenic is
Exactly.
they should know any a small amount of certain medications will knock you out. Like you give someone, I mean, let me think of like what is a medication that we give such small doses of when God, there's a medication that we'll give for like really high blood pressure and very, I love how it's slipping my mind. But we're only allowed to give like zero point 0.1 milligrams. Like,
Yeah.
or we will send our patient to a full blown,
Right.
hypotensive episode where their heart just stops.
Exactly. And I often say, like, with things like PFAS, for example, the Teflon chemical, that was never naturally occurring in the environment, ever. So who's to say that even the smallest percent of that is not harmful, right? Who is to make that conclusion? Because we will not ever be able to make that conclusion until many years go by and populations and populations of people suffer. And then we're like, oh, wow, we just realized that this is a big problem.
Yeah.
And that's usually how, these things are discovered. That's, when lead gasoline was put into lead, when arsenic was used as a pesticide, when DDT was used as a pesticide, these things were just approved and used because capitalism, right? And people don't often want to think about foresight, what might happen. And then the after effects, people are the ones who suffer with it. And I think infertility, the reason why I'm emphasizing environmental medicine so much with it is because to get pregnant is such an intricate process, right? There's so much that has to go right in order for a successful conception to happen. And so there are so many factors that can play a role that are unseen, unfortunately, that I think women are paying the price for. So, yeah, unfortunately, I think that's just one example, but another example I often give, a lot of providers don't know, undiagnosed celiac disease causes infertility.
Oh.
So
No,
celiac disease is when your body attacks gluten, your immune system can't tolerate it, and it damages your intestine in the process. What celiac disease doesn't always present with the same symptoms in everybody.
It is such a tricky
Yes.
condition to diagnose.
Yeah.
Because even the standard of what we are taught to expect. I mean, I've come across patients. I ask a lot of my patients when they have autoimmune conditions. I was like, how did it show up? What prompted you to get investigated? And I'm shocked at like just the variety. And even in celiac, it was like the idea like I wasn't growing, or like I was just constantly bloated, and they were just telling me, yeah, you're just sensitive. And it's like, no, this isn't. I was constantly fatigued, and no, it's just like no rashes, the typical rash that we expect with celiac disease. They didn't have that. They, it wasn't like their growth was so stunted that it was dangerous. Subhanallah, yeah.
Yeah, and the thing is, infertility can be the symptom for someone, right? So like, or repeated miscarriages can be the symptom. So they might not have any GI issues, no stomach problems. They might not have any bloating. They might not have anything. The fertility struggle or the miscarriage or the whatever it is the actual symptom of the the celiac disease, for example. So
Mhm.
there's like things that are outside the box. I think oftentimes, unfortunately, in medicine, we're taught so much to think in boxes and just steps and procedures, when because also we're trying to do things so quickly, see one patient after the next, trying to just get people in and out of the hospital. But when you take the time to just sit and understand and just think, okay, what are all the potential causes that are impacting here? I wonder, I'm just curious, of the 25% statistic that doctor gave, how much of it is actually undiagnosed celiac, how much of it is high PFOS exposure, how much of it is high glyphosate exposure. Just UC Berkeley, a big researcher, did a 20-year study on glyphosate, which is a pesticide exposure, and she found that it can cause potentially fatty liver disease in children, right?
Wow.
What do you think that's going to be doing to fertility, right? So, and those kids and their mothers and everybody else in that area. So, and we're talking about UC Berkeley here, right? But this is not,
Yeah.
out there research. So this is only a few, again, of thousands of other exposures that we have. And unfortunately, I think that this is where functional medicine can shine, in that it does prompt you to think outside the box. And yeah, I just would say to anyone struggling with fertility, don't give up, and know that you deserve to be heard. And yeah, there's potential other causes that sometimes some of them are known and some of them are not.
Someone actually dropped a question, and I want to honor the fact that I asked. I
Yeah,
usually ask them if they have questions, go, drop them in the comments. So, Pumpkins, that's a cute username. She's had a great conversation. I would love it if you could talk about stress causing things like ovarian cysts. I'm struggling with them myself and have been exploring using my faith as a Muslim woman to reduce stress. Ovarian cysts are so, I mean, I can't tell you how many times I've seen in ultrasound reports ovarian cysts, as a, in fact, just yesterday. So I laugh with one of my sisters. She'll have like a random friend or coworker who will like, get some blood test done or an ultrasound done, and then she'll be like, "Oh, I have a sister who's a PA. Let me." And I literally, I was like, "Do you not realize that this is medical liability for me? Tell them go talk to their gynecologist." But she had just sent me a report, with the permission of the person, clearly, and there were ovarian cysts reported on the ultrasound. So just curious to know what the heck is happening there.
yeah. There's many different causes to cysts, so it's hard to say exactly the particular reason behind it. It can be, if someone has underlying PCOS, if someone has underlying endometriosis, that can cause something called a chocolate cyst. Sometimes it can be non-related to any of those things. But does stress, or can stress play a role? I'd say, stress plays a role with nearly everything, and I definitely would not rule it out as a potential instigator to, basically, really, whenever the body is experiencing a heightened nervous system state, right? And we're always activated and everything is on high alert. That doesn't only put your brain on high alert, that puts all your organ systems on high alert. Your immune system is going to be the main secondary organ system that's going to be on high alert. So when your brain is really freaked out, if you're running away from like a lion that's about to eat you, right? Your immune system is going to be ramped up because, let's say you got bitten, right? And you got an infection, right? Your immune system needs to be on point immediately to come in and make sure that you're protected. If you tripped and fell and you scraped your leg, or whatever it is, right? Or you drank from dirty water and you got some poison, right? So your immune system is upregulated very oftentimes when your nervous system is upregulated. And a lot of times with ambiguous symptoms that can come along, I just always think, now I'm not saying for this specific person whether this is the actual what's going on.
Yeah, clearly, yeah. This is here's a little disclaimer, and the disclaimer is actually in every episode, which is nothing here is diagnostic. This is just commentary. Take it, if you are having issues, go see your medical professional. You're, someone that you consult with personally. There's no liability here. So,
Yeah, yeah. But I always think about with cysts, I always think about inflammation. I think about also, sometimes estrogens play a role too, but that's hard to know without knowing the rest of the history of the patient. But, whenever you have a heightened stress state, you have a heightened inflammatory state oftentimes. And when you have heightened inflammation, meaning your immune system is agitated constantly, like on edge, right? There are going to be things that are growing that shouldn't be growing, or going on that shouldn't be going on. So I know it's a vague answer, but I think without knowing more, I don't know if you have more
I
insight
did.
to that.
I, it's it's a lot of people don't realize. So, although I can't call myself a functional medicine practitioner yet, inshallah, the intention is that sometime in the future to finally complete my certification, because my patients know I'm like, okay, we can. Here's what I'm going to tell you as an option, and then here are the 5 other things that I want you to do, like, and also look into, please, because it's just we need to truly have an integrative and holistic approach. People are people with multiple body systems, and one of the most powerful tools you have as a medical practitioner of any sort is the history.
Yeah.
And for those who don't know, when I say history, what does that mean? When you go to your doctor's office and they sit down, then they ask you questions like, when did this start? And how long has it been going on? And is this present? And is that gone? And did you do this? Right? All of those questions, that's history taking. And a
Yeah.
regular, in a regular sick visit, it's like a 2, 3, maybe 4 minute process. With a functional medicine practitioner, it is sometimes an hour long. Like, they want to know
It's
everything,
very long. Yes.
everything.
Yeah.
Not just like when did it start, but what are you putting in your body? How are you moving your body? Tell me about where you grew up physically. What was around you? Were you near factories? What kind of house or place did you live in? Right? They're thinking about environmental toxins.
Exactly.
As a trauma coach, like, I cannot overlook the importance of understanding someone's social history and the trauma that they experience, because just like you're mentioning, abroad, the impact of nervous system dysregulation on our immune system, and the way there's such a significant correlation between past traumatic unresolved experiences and autoimmune disease, and especially in women. It should be alarming that women, between men and women, it's women who are more likely to experience autoimmune conditions, which are just, it is not something that should be accepted. And of course, there are so many environmental factors when it comes to autoimmune diseases as well. SubhanAllah. And then autoimmune like conditions that we don't even have a name for yet.
Yeah.
But
Yeah.
yeah.
Exactly. Yeah, it's definitely, um,
Hmm.
and it's a very good point that you bring up. And unfortunately, like with the intake process, for example, like I often just say this for the stark example, right? Like you said, sometimes it's 5 minutes tops. I mean, if a doctor is very nice, maybe they'll do a little bit longer. But like in our
Yeah.
practice, for instance, our intake process, we require our patients to fill out questions ahead of time that ask about everything from birth, from the moment their mom was pregnant with them, like what did their mom's pregnancy look like, because that impacts, like, your health is determined from the moment you're conceived, right? So that's when your health journey begins. It doesn't begin when your health problems began. It began when you were first conceived as a baby. And we ask it from then all the way until current time. And we ask about everything in between. Like you said, all the environmental exposures, your gum health, right? How are your ears doing, right? Everything. And really, it's only when we review those forms for hours before the first session, and then we spend 90 minutes diving into all those root causes and asking more follow-up questions. And really, it's then and only then, and we're talking now at this point, like 10 hours of work that's been put in. It's really then and only then that we feel like, okay, we have a solid understanding of what's going on deeply. And that's the art of medicine. It's being able to integrate all that information. I think a lot of that is lost, unfortunately.
Yeah. And even, I mean, I have to throw this out here because I still, I'm in the Western practice of medicine, that sometimes it's not that we don't want to do the thorough history. It's that we have about 5 other patients that are there, and we are oftentimes treating sickness. I work in urgent care. So
Yeah.
it's basically, you broke your, you broke your ankle, you have a cough that just started, or you're having an asthma attack. And so it's like, we got to jump from one where you sliced your arm and now you need sutures, right? So
Yeah, of
subhanallah.
course.
Yeah.
Every modality of medicine has its, like, and the thing is that modality of care is necessary. And my modality of care is necessary
Necessary.
too.
Oh my God,
It's just
so
that
important.
we need all those options so that when someone has a chronic condition, that type of long process, like that weeks for example, is more fitting. When someone has an acute problem, like in your situation, like you said, that's more fitting.
Yeah. We got a response from our lovely sister. Thank you for the answer. I'm looking to work with a functional medicine doctor because, of course, they just prescribed hormonal birth control for these reoccurring but simple cysts. Abrar's information will also be in the description if you want to work with her, because I think she'd obviously be a great option for that. Mashallah, tabarakallah. I want to talk about PCOS. I cannot tell you how many patients have made their way into my office, and they're not there for that. They're there for a cold. They're there for, potential pneumonia. But I just look at them and maybe I'm a little daring, and I'll just like, has anyone ever, I know you're not here for this, but are your periods regular? Like what are your periods like? And they're like, no, I haven't had it for 3 months, and it's very clear to me that they have PCOS. I'm just like, okay, let's get to the right person. It is alarming how many women have the characteristic features of PCOS and do not know. That's one. Like, no, that there is no way that they have made their way into a medical office and it was just like overlooked that many times. And then how many women you cannot look at them from the outside and tell whatsoever that they have PCOS.
Yeah.
And then because of issues with their periods, they end up, getting an ultrasound, the cysts are found, and it ends up being that they have PCOS with none of those typical, for those who, again, who don't, I'm going to say this a lot because we speak about it knowing the medicine behind it, but PCOS is considered a clinical diagnosis for us, right? So meaning we don't even need to run tests or, we can literally look at someone and with pretty decent certainty know if they have it based on what. Now that I'm coming across so many women who do have it and they don't meet those characteristics, like, I'm just so curious to hear your take on this, and I have thoughts on it as well. But
yeah, and you mean my thoughts about just the lack of diagnosis of PCOS, or how
what the heck is going on is a question of how did PCOS spike to the level that it has. And I know, I've done kind of the look into the data on this, and so I know, but for everyone watching, like, first of all, what is PCOS? Because no one knows, is going to hear that and, might not be familiar.
Yeah, so it stands for polycystic ovarian syndrome. However, it actually is probably going to be renamed in the next couple of years. I got there was like a mass research survey sent out to many healthcare providers from a couple of universities asking for suggestions for renaming it, because it's not a good reflection of what's actually going on. So not everyone with PCOS has polycystic ovaries, and polycystic ovaries means you have many cysts in your ovaries, and we're talking about like many. I mean, you can have upwards of 40 to 60 little like cysts, and they're usually like they're inside the ovary. And you can usually, in patients who have that, you can actually see it on ultrasound. It's sometimes called a string of pearls, because it looks like a string of pearls in the ovary. But not every woman with PCOS has cysts in her ovaries. So actually a lot of women have no cysts at all. And so that's why it's not really the best name, but that's what we have right now. So essentially the Rotterdam criteria are established. There are 4 main criteria for diagnosing PCOS. And so if someone has any of these 4 things, that's kind of what necessitates an investigation into diagnosing it. So number 1, having irregular cycles, that you don't have a period for more than 35 days at a time. Number 2, the polycystic ovaries that we mentioned, like having the string of pearls or multiple cysts in your ovaries. Number 3, having like excess hair growth in areas that are unwanted, or hair loss, like your hair is falling out and you're having hair on your chin, hair on your chest, right? Those kind of symptoms of testosterone potentially being in the higher end. However, a lot of providers make this mistake sometimes, and women don't know that you don't have to have clinically elevated testosterone in your blood levels to have that symptom. Like, you can have normal testosterone levels in your blood, but still have the symptoms of, elevated testosterone or androgens, which basically other male type hormones that can exist, because testosterone is not the only hormone, male type hormone that we have. There's other derivatives and sister hormones, I guess you could say, to testosterone, or maybe brother hormones is a better way to put it. But and then the 4th criteria is, if I'm recalling correctly, the actual like biochemical presentation of like elevated testosterone, like actually seeing it high in the blood. So point is, if someone is, struggling with any of those issues, right, that warrants definitely checking into PCOS. And why it's often missed, I would say it actually has become way more common now than it was back then. So like
Mhm.
many providers weren't even trained in what the heck PCOS is. Like so many providers never even were taught what PCOS is, even just medicine 10 years ago. It was barely even a conversation. It wasn't really discussed much. And there is a huge rise in it being presented more and more. And it really goes back to very similar root causes of, again, our environmental toxin exposure discussion that we talked about. There's multiple research trials on the impact of how BPA can potentially worsen PCOS presentations in women. And even, for example, we know that phthalates, those plastic derivatives, and that can be in many products, have been linked to early puberty in girls, right? And so when you
Which
are,
is also extremely alarming at how, I
yeah,
mean, uh,
it's so pervasive.
11 years old, fully grown, 10
Yeah,
years old, fully grown.
yeah,
And it's like, did anyone not look at this
yeah.
and think that there might be something going on?
Exactly, exactly. And again, not my statement. I mean, this is all, I mean, the NIH has this statement about the early puberty in girls and phthalates and BPA and BPS and things like that. So it's really alarming when you think about, okay, now you've disrupted the normal hormonal reproductive development of a child. What do you think is going to happen, right?
Mhm.
Is their reproductive physiology going to be normally developed later onto their life? I mean, that research is currently underway. We don't know, right? So
Mhm.
that's point number one. Point number two, also, our food system is a disaster, right? So, I mean, don't even get me started.
No, I don't even get me started to
Yeah,
a lot on it because my undergraduate degree is in nutrition. You're an RD. It's like, God, okay, keep
yeah,
going.
yeah.
It's
No,
I feel like there's like a lot of feminine anger between the both of us
yes,
right now because we're like, oh my God, why has this been
yes,
overlooked for so long and so
yes,
many women had to suffer and be told that
exactly.
there's nothing wrong when hormones affect you like mentally, you know
Yeah,
something's wrong, but just because the labs are normal, you're being told it's fine,
yeah,
not realizing, and I don't understand how people don't catch this, our hormone systems are so incredible. They know how to maintain homeostasis or this balance and not show even when something is off. It, like our body maintains that balance as best as it can. But it's like the button. I made a joke with one of my clients who was a little more busty. I was like, you know how like you button your shirt and it's fine, but then you one wrong move and you can see it like it's just holding together. That's what your hormones are doing
yeah,
sometimes.
yeah, exactly, exactly. It's like holding on for dear life. And
Mhm.
so with our food system, unfortunately, like the amount of research coming out on ultra processed foods, on
Mhm.
how ultra processing like basically means when you take ingredients and you manufacture foods in the lab, right? Like you take a starch and you do a series of chemical reactions to make, this very low keto carb popcorn thing or whatever it is, right? So a lot of these things that we're purchasing and buying, right, are filled with fillers and chemicals and additives that are going to be impacting our hormones very much, right? Because, like I said, they are our chemical messengers. They are the ones that are trying to keep the balance in everything. So, not to mention, of course, too, the whole side of the food industry that has made a big business and profit out of making foods addictive, making things easy to access. I mean, I often tell my patients there's no shame at all, ever, of like enjoying a donut or ice cream, right, every once in a while. But ask yourself, how easy was it for our grandparents or our great grandparents to access donuts, right? How easy was it for them? Like once a patient of mine went to Cheesecake Factory
Mhm.
and there was a cheesecake that had 107 grams of carbs.
Mhm.
107 grams of carbs. It's like to eat the amount of that in blueberries, you'd have to eat like at least 10 cups of blueberries, something,
Mhm.
preposterous like that. So, if our great grandparents, if in order for them to eat that volume of like sugars or additives or ultra processed things at one time would be so difficult, but it's so easy for us now. And it's not the fault of the consumer, right? The consumer has no clue oftentimes, right?
Mm-hmm.
So often, unfortunately, we're consuming things that we don't even know, right? What are the impacts of it are. The food industry is not required to do in-depth research studies on the effects of how these things impact our health, how modified starches may impact women's health. They don't do that research. That's not required for it to get
Mm-hmm.
approved by the FDA, right? So that's a whole other problem. Not to mention the way that our society and capitalism and everything is set up and the amount of stress that people are going through. I mean, we're talking about
Mm-hmm.
there's just so many different factors that are really contributing all together. And I often say, when the world is suffering, women suffer first,
Mm-hmm.
because our bodies are
So
always,
sensitive.
yeah, so sensitive and so always trying so hard to be in synchrony and balance with everything. And so we are empathetic, right? We feel things more. We have more fat tissue in our body, which is normal, right? Women, our breasts need fat tissue. Our ovaries are encased around, like there's fat cells around our ovaries that we need. Without fat cells, our bodies can't make estrogen and progesterone and hormones, right? So we need that. We
Mm-hmm.
are going to have more fat mass than men do. What does that mean, though? That is a recipe for disaster when combining it with environmental toxins, because most environmental toxin chemicals are fat loving. They absorb
Mm-hmm.
into fat tissue. So that means that our bodies absorb and harbor chemicals more, exactly, than the average other body in the world. And so women are always going to be a reflection of the suffering of the world,
Mm-hmm.
oftentimes,
Mm-hmm.
unfortunately. And that's
Mm-hmm.
contributing greatly, I think. Yeah.
Subhanallah. And so I run a trauma group coaching program for Muslims, and we have a whole section dedicated to like healing your femininity. So oftentimes, I'm gonna come right back with the connection, I promise. But oftentimes, the trauma response so many women just in general will develop is a hyper masculine kind of presentation to protect themselves.
Yeah.
And one thing that we do in that, this is a sneak peek for any ladies who are watching this, and my little pitch here, if you're interested in the trauma group coaching program, the links are always to apply is always in the description of any of my videos. But we talk about the verse, الرجال قوامون على النساء, that men are the caretakers of women. And we have the conversation around, this idea of like hyper masculinity has been pushed onto us throughout the many past decades, especially if you live in the West.
Mhm.
And yet Allah subhanahu wa ta'ala created our bodies to be so sensitive to change, in that we have a hormone cycle that, I mean, just looking at the menstrual cycle, right? Throughout the month we are shifting, whereas men
Yeah,
are not operating on that. And so
yeah,
we have to, the idea of protect your energy, like we're so sensitive to those changes.
yeah,
And when you think about something that is so extremely sensitive, and I don't say sensitive as an insult for any ladies who are watching this, but in the sense of easily impacted or swayed, there's so many beautiful things to come from that. You mentioned empathy. We think about nurturing, but it also is a reminder as to why women are to be taken care of. Like
mhm,
the idea of a caregiver requires something of immense value to care for. And so it's just a whole, I mean, even when we talk about PCOS, and one thing I wanted to touch on is the way cortisol levels
yeah,
affect our blood sugar, and then insulin resistance, and how that affects PCOS and so many other hormonal conditions. But cortisol being our stress hormone,
yeah,
if it's constantly spiked, we are going to experience the repercussions of that physiologically.
yeah,
And there are certain things that, and sometimes the men in our lives fail, and that's where we have to kind of show up as a community and say what is going on, and why are men falling short on their responsibilities. But then also, we talk about this in my program as well. We talk about radical accountability. Where are we falling short, and how do we ensure that we are driving our own healing, and
mhm,
not handing that responsibility to other people, because those who hurt you are never going to be the ones to heal you, subhanallah. But yeah, it's like it's so much, it's so well-rounded of a concept. So let's talk about that real quick, inshallah, and then we have one question from someone, and then we will end it there, inshallah. I do want to respect your time, and I so appreciate you staying with
no,
us.
of course, I'm happy
um,
to.
Insulin sensitivity, cortisol, what
Yeah,
is going on with that? So to kind of briefly preface, I'll have so many ladies, again, PCOS, they have diagnosed PCOS, and two things happened. Either they were put on birth control,
Mm-hmm.
or they were told you're going to be put on birth control, and they're like, hell no, not happening. And now they just have PCOS, and they don't even realize like that is not an okay thing to
Yeah.
just go on with untreated or unaddressed PCOS. And I tell my patients two things, and I'm just going to leave it to you because I know you're going to mention those two things. And if you don't, then I'll jump back in. But how does cortisol affect the development of these conditions?
Yeah, greatly. So, like I said, or like you said, rather, cortisol is your stress hormone. It's also your wake up hormone. A lot of people don't realize.
Mm-hmm.
So, when you're stressed out, your body can elevate cortisol, and it might not necessarily be clinically out of range in your blood values.
Mm-hmm.
Keep that in mind, right? Sometimes it's elevated in the wrong times in the day. So cortisol is supposed to naturally rise in the morning and then fall throughout the day, and then you're supposed to have it at its lowest end in the evening, where melatonin then takes its place and helps you go to sleep. But I see so many women where that's like flip-flopped or totally wacky and right
Mm-hmm.
all over the place. They're spiking, like they feel suddenly like I feel so wired at night, and
Mm-hmm.
their cortisol is elevating in the evening hours, and their stress is impacting then the whole day, right? There, if you have elevated cortisol in the wrong timings of the day, and your melatonin then is not functioning properly because of that, right?
Mm-hmm.
Melatonin is not just a sleep hormone, but it's also a detoxification hormone. It cleans out your brain. It helps to rest you. It helps to make sure that you have literally cleaned out cells. Like it's like a vacuum cleaner for your cells, is what I often like to say. But also, your ovaries have many melatonin receptors on them.
Oh, no way.
Yeah, which is really amazing. So your ovaries actually
Dang, of all of us
every
staying
night.
up late.
Yes, yes. Every night your body bathes your ovaries in melatonin. And the reason why is because it helps to repair DNA damage in the
Mm.
oocytes, like in the egg sites, in the egg cells. And actually, that's why we often use melatonin as a treatment, or rather, like a support for egg quality issues, for endometriosis, for fertility
Wow.
support, actually. So there's a lot more studies coming out on melatonin's effects of all of this. But that's just one example of like, okay, your stress is now impacting your cortisol, which is now impacting your melatonin, which is now impacting your detoxification processes in your body, which is now impacting the quality of your cells, which is now impacting, like you see how it's a cascade
Which
domino.
then cascades if you have
Yes,
children. Your children
exactly.
are, when conceiving, that's the quality of the egg cell that becomes the
Exactly.
fetus, which would be,
Yeah, if you
that
have
becomes
DNA
the baby.
damage in the egg cell, exactly, then that's going to impact what the
Oh, wow.
embryo, how the embryo develops. And then from an insulin perspective, right, that's only melatonin. So
Hmm.
taking
Let's
it,
talk. Yeah, insulin is
yeah, from,
what we typically hear about.
yeah, exactly. So from an insulin perspective, insulin, I often like simply describe it as it's the hormone that your pancreas makes to control your blood sugar, but it's also a pro-growth hormone.
Mm-hmm.
It loves to grow things. It grows tissues. It grows a child while they're growing up. It helps you grow in pregnancy. It helps to grow things for you, right?
Mm-hmm.
So every time like let's say you eat something, your insulin rises because it helps to take nutrients and food blocks that you ate and process them into muscle tissue that you might need, or some cells that need to be created and repaired and things like that. So it's a pro-growth hormone. So if you're constantly stressed and your cortisol is constantly spiking, that causes your more insulin rises and more insulin spikes as well throughout the day.
Mm-hmm.
This is where patients tell me, I just can't lose weight. I just feels like my body's stuck. And stress is a huge piece to that, because if your cortisol is constantly elevating throughout the day or having incorrect elevations in the wrong times, right, your insulin is going to also have a harder time rising and falling in the proper wavelengths throughout the day. So when you
Mm-hmm.
eat something, you might have a higher insulin spike, right? More insulin is being produced to control your blood sugar, which will result in more fat tissue storage, right?
Mm-hmm.
Because again, insulin is a pro-growth hormone. So if we're making more of it, we are going to have more storage of fat cells.
Mm-hmm.
I'm talking very simply, obviously, but on a very basic level. But then also, whenever we have spikes in insulin repeatedly, that increases inflammation. It agitates our immune system. It is not a happy place. So I often tell my patients, like, if your brain is constantly being told, oh my God, our blood sugar is too high. Now it's too low. Now it's too high. Now it's too low. Like, how stressful is that for your brain, right? And when your cortisol is elevated, it actually makes you more insulin resistant, which
Mm-hmm.
means it makes your cells less responsive to insulin. And so when your body makes insulin to try to lower your blood sugar, it's just like the insulin going and knocking on the doors of the cell saying, hello, let me in. I'm coming to lower our blood sugar. And the cells are like, who? I don't hear anything. What? And so basically, your insulin is not doing what it needs to do. So then your body makes more insulin and more insulin because the
And that,
cortisol made your cells non-responsive to it.
and that's how our body typically works. I mean, for a lot, for, you know, our hormones work on feedback loops, and it's like if it's not
Mhm.
responding, let's spike more. And in fact, that's how,
Yeah.
you know, typically for us, that's how we know something's wrong, is because the labs, we see that certain hormones are completely out of proportion, meaning the typical organ or whatever that's usually responding to that specific hormone is not responding. So the brain is like, okay, like make the louder, like let's make it louder.
Mhm.
Maybe it'll listen to us now. And I don't, I'm trying, I don't know if you had mentioned this, but the fact that cortisol spikes blood sugar. And
Right.
then when we add on to that, the fact that we consume certain, consume certain macronutrients, carbohydrates specifically, that then also will spike our blood sugar, though to different levels depending on what it is specifically that you're consuming. Is it a simple carb, complex carb? Now you have this already high blood sugar from cortisol levels, then from what you just consumed, then our cells are supposed to take that blood sugar and put it to use. But now insulin, it's not responding to insulin. Insulin is like the key that says unlock, unlock the cell to let the sugar in. Then additionally, we're in such a sedentary society that, one thing that's really helpful to get the blood sugar into the cell is actually movement, because
Mhm.
our muscles then begin to contract, and they will start to use the blood sugar as a form of energy, because that's just the fastest way to get it. And it's just like this world of chaos. Now
Yeah.
that we know cortisol and insulin, right, is causing these blood sugar spikes, which then leads to us becoming insulin resistant, and that affects the way we put on weight, our inability to lose weight. It affects the health of our cardiovascular system, which is, our heart and our blood vessels. It affects the condition of our brain, like the
Yeah.
health of our brain. A lot of people don't realize that. They think it's only the heart. Our brain is deeply impacted
Yeah.
by insulin resistance.
Dementia is
Yeah.
sometimes called type 3 diabetes,
Hmm. Hmm.
Yeah.
Yeah, and I believe that is a more recent, like,
Yeah. Yes.
bout of literature that came out about that, now referring to dementia, or I don't know if it was specifically Alzheimer's or dementia as a whole, as type 3 diabetes, subhanallah.
Yeah. Yeah.
And then and so it's like, we bring this up, and it might seem so complicated to people watching, but it really isn't that complicated, because once you understand the mechanism, then you know exactly where the interventions can go. I literally do this with my coaching clients. Here's your issue. Let's talk about all the steps that got you there. Good. Now we have our targets for interventions and what we're going to do to make sure you don't get there again. So, we're in regards to all of that in PCOS. What helps? I don't know if you're someone who says we
Yeah.
can't cure, we can only put into remission. So I'll say, what helps put PCOS into remission? Now
Yeah.
knowing this mechanism.
Yeah. And no, I think it is good to have that mindset with PCOS. It is more management, and
Mhm.
it's
Because it can always come back if you start doing the wrong things
exactly,
again.
exactly. It's not like, it can disappear completely. It's always kind of there, but you can manage it very well potentially. So I just want to make a quick point, and I'll answer your question. The quick point I
Absolutely.
wanted to make is just, oftentimes patients will vilify carbs when we have these
Hmm.
discussions, and they'll be like, "Oh, I just should cut out all carbs." Remember the root cause of why, that's even an issue to begin with, right? So
Hmm.
you don't ignore the fact that your stress is impacting and then just hyperfixate on the carbs.
Hmm.
And
Hmm.
remember too that, like, not all carbs are the same, and the way that we combine carbs with other macronutrients and protein and fiber all makes a big difference. So I just wanted
Yeah.
to say that. But the solution is not over restricting, and oftentimes that backfires and makes
Hmm.
things way worse. So please do not ever take from any of this to that you should just be over restricting yourself and dieting. I often say, if you go on a diet and you're not going to do it forever, right? And most diets are not meant to be like that anyway, right? Then you're just going to be at ground zero where you started from the beginning, the moment you stop. So don't ever think of health as never short term. You are always having to establish lifestyle changes.
Exactly. And I'm sorry, I'm gonna butt in right here because I think you just touched on such an important point. I have a lot of women in my life, and even just for my patients oops, I accidentally unmuted myself, who will hyperfixate on like short-term diet solutions to
Yeah.
what they're. And we mentioned carbs because the American standard diet is so heavy in simple processed carbs, and so it's like I remember I think it was Dr. Peter Attia who said that. It's like if you just look at the quality of the diet, there's no like it becomes such a clear target for what can be shifted to promote better health. But I see so many women who will fixate on these diets and then not realizing that this constant I'm going to try this and then it's not sustainable, so I fall back. This constant switch up in the way that what you are consuming is literally confusing to your metabolism, and
Mhm.
that can actually further the damage to your hormone health.
Yes. Yeah, exactly. Yeah, yeah. No, thank you so much for emphasizing that. And to your last question about the PCOS and the impact, I think it's there's a lack of nuance online, especially about the different phenotypes of PCOS. Not
Hmm.
all PCOS is the same, and
Hmm.
so there are some women whose PCOS is very metabolism driven, meaning when their insulin is elevated or they have insulin resistance and their blood sugar is suffering, their periods suffer. And the moment that they start to improve their insulin levels, their periods improve. And there's a lot of mechanisms behind this. We know that insulin spikes increase testosterone production. It lowers estrogen production. It can lower SHBG, which is called sex hormone binding globulin, which helps to regulate our testosterone levels and helps to keep our hormones in check. I often call it the hormone police as an example. But basically, in a nutshell, the way that our menstrual cycle operates is very tied with our insulin and blood sugar. However, not every woman with PCOS responds that way. So
Hmm.
I've had many women in my practice with PCOS who we've done all of that work. I've been with them for like an entire 6 months or a year, and I know I even tested their blood sugar on with a continuous glucose monitor for 2 full weeks and saw exactly data point by data point what their blood sugar is doing. And I know that it's pristine. I know that it's working greatly. We worked on stress, did a bunch of good, conjunction with good therapists and things like that. And their PCOS that's not the main cause of their PCOS. So sometimes it's more related to like issues with how the hypothalamus is communicating to the ovary. Um,
Hmm.
and so sometimes I will say it's more common a lot of times that PCOS has a metabolism component where insulin and hormones play a big role together. But there is still a subset of women that it is genetics plays a bigger role, from the structure of the brain to the structure of the ovary, or there is a bigger role from the side of progesterone, or LH and FSH. So I don't want any woman to like do all this work and then feel like, oh, I'm a failure because I just didn't restrict hard enough or I just didn't try
Hmm.
enough. And I think that's so sad because I've seen those patients in my practice feel that way because of how the internet shames women to thinking like you just didn't try hard enough.
Hmm.
And that's not always the case.
It's just a completely different mechanism for them.
Yeah, and you have to treat it differently. And that's where, I often say like DIY medicine at home, it only gets you so far. And,
Hmm.
speaking with someone, an expert that can help to guide you through the process of lifestyle medicine is just as important as you wouldn't do your own heart surgery on your heart, right? You would get an expert guidance from a cardiologist, right? So lifestyle medicine, like you said very eloquently earlier too, it is a science, right? Every time I see a patient or any of my teammates in my practice see a patient, we're thinking about, okay, what are all the biochemical processes going awry here? How is insulin and testosterone and SHBG and free estrogens and estradiol and cortisol and ghrelin and leptin, like how are all these things interacting together? How are all these different hormones playing in this orchestra together? And then from there, combined with the history, combined with labs, combined with questions we ask, then we can really get the best outcome for someone. So anyway, That's
No, that was so helpful and so powerful. And I keep seeing resemblances. I
yeah,
don't even know if that's a word, resemblance. Yeah,
yeah,
resemblances between the work that I do and the work that you do.
yeah.
Because when I'm working with my trauma clients or even my one-on-one clients, and they'll come to me like, Hannah, I failed at this, or I messed up here, and I'm like, okay, let's stop. First of all, no toxic shaming allowed. That's rule number one.
Mhm.
Then rule number two is that this is data, this is information. So what does this tell us? Okay, you messed up here. You got into a fight. You were triggered by something, and your dysregulation got to a point where you said or did things you weren't proud of, despite us, working on these coping strategies or this integration work that we did. What does that tell us? Maybe this trigger in particular is a little more stuck, and so we need to hyper focus on that trigger. Maybe it tells us that I cannot tell you how often, abroad, I will bring up like cycle syncing or okay, tell me where you were in
Yeah,
your,
yes,
were you about to start your period? Were you in the PMS? Okay, stop shaming yourself because
yeah.
you do not have the same level of stress management that you do when you're ovulating. So let's have that awareness and start thinking, okay, if this is the case, then I need to put up some extra barriers so I don't get super dysregulated, I don't get super triggered. It's data. And I absolutely love, 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 love. Okay, so very often, and I'm actually curious about how you go about this, but very often, I'll see like hormone health experts or whatever. Yeah, they call themselves that online, and it's like they'll typically put you on a plan, and then there's a lot of subjective. Do you feel better? Are your periods happening more? The fact that you talked about like so clearly you're drawing labs, you even just the fact that CGM, for those who don't know, continuous glucose monitoring, you might see it on someone who is a diabetic, especially type 1 diabetic. It's like a little a device that is placed on the skin. It has a teeny tiny needle, and it's basically constantly measuring blood sugar. So you have true like objective data points,
Yes, always.
exact.
Yeah.
And that is so, so important to work with someone who is able to do that, because then you can get right down to like, you can figure out exactly when and possibly why something is happening the way it is happening.
Yeah.
And that's super encouraging. That makes me like giddy. And maybe I'm going to say this is my favorite podcast episode so far.
Thank
And
you.
maybe it's just like the medical side of me. I've always loved
Yeah,
science, always loved physiology, and
yeah,
this has just been so fascinating.
yeah, me
Um,
too. And yeah, I personally, just the way that uh, like the way that I love to practice, and I know the way that the rest of my teammates, the reason why I brought them on with me is that we're all very like-minded in this. It's if you can understand the very core basic biochemistry, there's so much power in that. There's so
mhm.
much, and don't get deceived by many people on the internet who unfortunately don't have that training and oversimplify things.
You have a PhD. You tortured yourself for that title. Allah, your English. I don't know how the heck you do it.
Um,
Someone told me, they're like, "Are you gonna do a PhD?" I'm like, if you ever hear me say something like that, like, shoot me in the head. Because I'm kidding. It's a little dramatic, but that
I
is.
nearly died from it. It
I
was
know I've had friends who do PhDs, and I'm like, you did this to yourself, so I can't. I
yeah,
can't. I can't say anything to you. But mashallah, tabarakallah. I say that to say it's an extremely rigorous process, and you become the expert quite literally. That is whatever you're doing in whatever you're doing your PhD in. So,
thank you. Appreciate it.
subhanallah. With the final question, first there was a viewer who shared an experience. She was watching on a bit of a delay and had an ovarian cyst when she was in college and ended up in the hospital because of the pain. Subhanallah. And she
Mm,
just talks about basically being treated. I know you mentioned antibiotics. I would antibiotics are not usually used for like a cyst unless there's some sort of infectious process that happened, but basically treated then sent home, probably given a referral to go see a gynecologist, but like how traumatic of an experience that has to be for women, subhanAllah. And the final question, I think this is a beautiful place to end, is could you please advise us as women on what precautionary measures we could take to maintain our health, fertility, hormones, body, how we track our cycles? So any parting advice for all the lovely ladies who are watching and the many more that inshallah will be
yeah.
watching after. If you want to turn your video off and then on again, because if they're okay, it's good. It's back again.
Okay. Should I turn it on and off again? Or
Yeah, I don't know. We'll try it.
I'm sorry, I don't know
No.
why that's it's. I never had a connection issue earlier today. Anyway, point is, yeah, it's a fairly good ending of like parting advice of what to do.
Mhm.
I would say, well, on a very basic level, um, you know, I guess it's so unfortunate. Like there isn't more research, more I mean resources than there is, but I guess a little bit of you know something that could help is our website has a lot of free information. We have about, I think, 8 free ebooks on there,
Oh, wow.
and yeah, if not more, and then, nourishwomennutrition.com. We also are coming out with a free course in the next couple months,
Incredible.
which is basically Hormones 101. Like, how do you understand what like, a lot of women aren't even taught, like, what is my body doing, right? What are the basic core principles of taking care of yourself? So actually, we will be coming out with that free course, hopefully this coming fall. So if you sign up for the newsletter, you'll get access to that
Mhm.
um, and get that information. Of course, the Instagram is always a source of information that anyone
Mhm.
can follow. Again, Nourish Women Nutrition is the handle. Um, in terms of like an actual action item, I would say for I know there's a lot of things that were mentioned, like tracking and keeping a tab on your health. I would say don't wait. I think is the main thing that comes to mind is like don't wait until your body is crying for help. Please
Mm,
pay attention to the early signs. Pay attention to that odd little rash that just started and wouldn't go away for 4 months. Pay attention to, the period pains that are creeping up and becoming worse and worse. Pay attention to, if you're having strange, recurring UTIs or vaginal infections, pay attention
that's
to those.
huge.
Yeah, yeah. Pay attention and don't wait because oftentimes, unfortunately, patients come to see us after years of suffering, and then we have to undo so much years of suffering. And if only they had come a little bit sooner, right?
Mhm.
Things would have been so much easier to fix in a such shorter amount of time. So
Mhm.
I guess to first get to know your own body, right?
Mhm.
So I think the best piece of advice I could give that you could take home with you is understand your cycle in your own body. So very basically, like, and in the free course we're going to make, it's actually we're going to go into like how to understand your basic fertile signs and stuff like that, your basic tracking. But
Mhm.
there's lots of great free articles on the internet on this topic already. But essentially, just know like, okay, how does my cervical mucus look like in the first half of my cycle? How does it look like in the second half of my cycle? Like, track it every day in an app or on a sheet of paper.
I tell all my you better have an app. Just there are
Yes.
tons of free apps. Track it because knowledge is power. And when you start noticing, I'm so sorry to interrupt you, but
No, no,
this
no.
is so like
Yeah.
when you start noticing, oh shoot, my depression spikes right around here each month, or I
Exactly.
feel so all of a sudden
Yeah.
absurdly anxious and I can't figure out why, but it keeps happening around the same week.
Exactly.
It changes so much. This
Yeah.
is again all I think at this point every single one of my clients has been walked through this method because they will talk about like I was doing really well, really, and then I crash and they're going into this like chaotic state of mind, like is something wrong? It's not work. This work is not working, and I was like, wait a minute, it
Yeah.
was the week before your period, wasn't
Yeah,
it?
your
They were,
luteal phase. Yeah,
yeah.
exactly. So like track your mood every single day, track your cervical mucus every single day. You know, don't just look at what's your body's making, right? Those are signs, those are ways that your body's trying to communicate to you. Ask yourself, how is your GI health, right? How is your digestive system doing every day? That changes also throughout the cycle.
Mm-hmm.
How's your pain scores? So keep track. And when you have tracked data, like you said, Hannah, was a really good point. Data is so valuable because if something goes awry, even if you're perfectly healthy right now, if God forbid something happens,
Mm-hmm.
if you do need to talk to a provider, even if it's in a hospital, if you have that data for them, that is gold, right? That is going to help inform much more educated medical decisions for your body than if you had no information. So,
Mm-hmm.
for example, even if a woman is struggling with fertility or really or even difficult periods, and she comes in and she just says, yeah, I'm struggling with this,
Mm-hmm.
versus she comes in and says, I noticed that in this half of my cycle, this is what's going on, and then when I'm ovulating, these are the
Yeah.
pains I'm feeling, and when I'm in my luteal phase, this is what's going on. That is empowerment. And that way no one can gaslight you into thinking something happened that didn't happen, or something that didn't happen, that something that happened did not actually happen.
Mm-hmm.
So I'd say empowerment is your own understanding your own body and how it functions.
Oh, perfect.
Yeah.
Oh, well, Jazakallah khair, Abrar. This has been extremely enlightening. Genuinely, like this was a genuinely enjoyable experience, and I can only imagine that if I, with a full blown like degree in medicine, learned as much as I did, that the women and men, because we also have male viewers who are very like staunch, dedicated viewers, mashallah. They've learned so much, and inshallah, we can use it as a means of our own personal empowerment, taking charge of our health, not allowing people, just like you said, to gaslight into thinking that our bodies are functioning normally when really there's something going on, and true prevention, right? Instead of waiting for something terrible to happen, being able to actually say, I'm going to take charge. And like we call this in my program, we call it just taking charge of our own autonomy, right?
Yeah.
Just honoring, I call it honoring your autonomy. We
Yeah.
have the opportunity to bulk of information, find people who can, help us and serve us on our journey. Tell people where they can find you, inshallah. And by the way, for those watching who are like, where do I find Abrar? How can I follow this woman? MashaAllah, tabarakallah. I linked her website and her Instagram handle in the description. If you cannot find it, click refresh. That's what I was doing when I realized that I had your bio, but I had forgotten to link the actual website. So just hit refresh after we end, and you will be able to access all of that. And of course, I'm sure there are ladies who are like ready to book appointments or do intakes or whatever the process is. Jazakallah khair. Unless you have anything else that you want to add.
Just wanted to thank you so much. I genuinely had so much fun talking with
Alhamdulillah.
you. Wallahi, we really were on the same wavelength the whole time, which was very
Yeah,
nice.
alhamdulillah. I
And thank
told you, girl, I followed you years ago, and I keep having these moments where Allah subhanahu wa ta'ala is bringing people from my past who I never would have thought, I never thought I would be able to have a conversation with you. Like he's bringing them into this, and I made a dua. I was just like, yeah, Allah help me to help, like, Muslim women around the world better themselves, and like allow me to be a means of service. So if that means that it's through finding women like you who are just so honed in on their craft and things that I'm not an expert in, and like offering a platform, then I'm so happy to see that. A brief fun announcement actually before I close, because I might as well say this, inshallah. There is hopefully there is an intention to create a digital community for Muslim women around healing. It's gonna be basically $1 a month, super super low cost, but just being able to access these resources, inshallah. So if anything shifts off, the YouTube channel would be over there, and I would absolutely love to like have you on again for those ladies
yeah,
once we get that up and running.
of course, I'd be happy to. Thank you so much for having me and for having this podcast.
Alhamdulillah.
And yeah, I appreciate you so much. It was really fun.
Awesome. And reach out to me if you ever need anything. I don't know if I can be of any help with it, but khair, inshallah, anything.
No, thank
Yeah,
you also for all the work that you're doing for all the Muslims
alhamdulillah.
in the world, and just it's so nice and refreshing to see more and more people doing this work. And so
Alhamdulillah.
appreciate you so much too.
It's so needed. It is so
Yeah.
needed. It's a
Yes.
blessing. All
Yeah.
right, guys, give us salam in the comments or the live chat, and we will see you next time. Assalamu alaikum.